Hi, I want to welcome you to Building Health with Vickie. And the verse today is Hebrews 12:1 through 2a. Therefore, since we are surrounded by such a great cloud of witnesses, let us throw off everything that hinders and the sin that so easily entangles us. And let us run with perseverance the race marked out for us, fixing our eyes on Jesus, the pioneer and perfecter of our faith. Today's subject is going to be ticks, Lyme disease, and co-infections, and also the meat allergy called alpha-gal. It's got a longer name, but that kind of covers it. Lets you know a little bit about it. That it is and when it says meat, it means anything that's a mammal. So, and I'll get into all how that works in a little bit, but starting off with how we even got into finding out that we had anything going on with this with Casey. It was when we went to Dr. Latimer's office. One of the tests that she ran was called the Western blot test. And on that one, found out after, they ran all the tests and let's see, that was March. So it was sometime later. I mean, it was close to September. I don't know why it took so long. The test just may take that long. I don't know. But it was sometime later we got a call saying that Casey had ehrlichiosis. You get your dogs tested for that if you take them to the vet regularly. But it's a test that they do for a bacterial disease it can spread from tick bites, and the symptoms include fever, chills, headaches, muscle aches, nausea, vomiting, diarrhea, and rashes. And they usually appear 1 to 2 weeks after a tick bite, but they can be so mild that you don't even notice it, or it can, if left untreated, it can be fatal. Well, Casey ended up testing positive for ehrlichiosis, which her immune system was so down, it made sense that that was a real possibility. So the treatment is doxycycline. And then with the doxycycline, it's just like a normal course of it. I can't remember if it was, I think it was 10 days. That's probably what it was. And that took care of it. If you don't have it treated, 1.8% of the people it can be fatal for if left untreated. And just the normal things for going out as far as tick, watching out for ticks is what you want to do. And let me see if there's anything else. It's best if you get it right off the bat, but we definitely didn't because we didn't even know she had it for quite a while. Now, the other thing that we later found out, and some of these things like Lyme disease and Bartonella, you may have those, but they don't show up on a test unless you catch them at this right window. If you test too soon, it doesn't always show up. If you test too late, so that can be a little harder. So sometimes it's a clinical diagnosis. And for Bartonella, Casey had a clinical diagnosis, and one was these like stretch marks on her inner thighs. That was indication, and she had a tick bite around there. And then the other symptom was uncharacteristic rage. That's not like Casey at all. And so that's another possible symptom of it. And then other symptoms, sorry, dogs. Other symptoms are fever, chills, headaches, fatigue, muscles and joint aches, and swollen nodules. Later, it can be, other things that could be even more serious. It can attack the heart, cause arthritis, facial paralysis, cause nervous system issues, and those erythromycin is what was used for treating Bartonella, and then Then we were seeing after she was having IVIG, a lot of symptoms that are associated with Lyme, with just some neurological things that were going on that the doctor had seen in the past associated with Lyme. So she was put on 28 days of IV, going to the hospital every day for IV infusions of an antibiotic for that. So that is what was used to treat that. Now, going to talk to you a little bit about something called alpha-gal. That is the meat allergy, and that is the abbreviated word. I forgot the longer one. It's really long. So, okay, excuse me. Okay, but that surprisingly, and what kind of brought that to light was Martha Stewart. Okay, remember the inside trading story about Martha Stewart? Well, it had to do about something with alpha-gal. Vanderbilt was doing research on a particular drug for cancer, and the people, a lot of them were doing amazing with it, and then some were dying bad. So with that happening, they later found out that the people who were dying were ones who had had tick bites, and they had alpha-gal. So that is what we found out as far as what was the reason for that. She got tipped off about how the study was going, and so her investment in that, I think they must have pulled out or something like that. I don't know all the details on that, but anyhow, so that's what got her in trouble, and with insider training with something called I'm clone, I think. Okay, and but with alpha-gal, Casey found out about that because she was given, because of being on all the antibiotics, it really messed up her gut. And we were doing probiotics with her primary care provider in hopes of helping to get her heal her gut. And because and of course it was out of pocket, and we were doing the probiotic was beef based. So I accidentally spilled a little bit in my hand, and I just touched it to my tongue. And when I did that, my tongue started swelling, and I had already found out just, I guess, 5 years before, something like that. It took a long time for me to find out that that's what was going on with me, that I had alpha-gal. And, her symptoms were more vague, so it didn't show up in the same way mine or the same way that my son's did. We later had found out that he had it in between me finding out and Casey. My symptoms were just, I would feel like I had PMS on steroids. My son had migraines, and extreme migraines, like losing sight, provincial, I can't say it right now, good grief, all peripheral. Well, that was hard. Peripheral vision, losing our peripheral vision, and he'd call us because he couldn't see to drive when he would start coming down with the migraine, before we found out that it was actually alpha-gal that was causing it. Now, Casey, for her, like I said, it was more vague. I would just swell up a whole lot. Like I would go up 1 to 2 pant sizes. So I'd just be so inflamed. Hers, we didn't know, and she was so sick it was hard to tell at first. But now she says it feels like popsicle sticks inside her brain. Somebody else has described it as pop rocks going off inside their brain. So, and then she feels like she's being poked all over her body. So it just totally impacts her nervous system, something awful. But so when I touched it and mine swelled up, that's when I knew we needed to have her tested. At that time, she was a level 3. Okay. And level 6 is where you get to the doctor within 15 minutes or you could die or less. Um, Level 1 is if you don't get bitten by a tick that has this, it can get to the point where you can reintroduce meat again. But we've tried, even though it's like 1 point something is where I was the last time I was tested. And Casey now is around there too, since we've been avoiding meat for some time. And that is other than chicken and fish. Um, but anyhow, it didn't go well, so we avoid it, and that's totally changed my life. My husband can tell you I used to wake him up in the middle of the night because it's 6 to 10 hours after you eat it. It usually happens, and as far as the reaction that your body has to it, and I would wake him up not knowing what was going on and would tell him we need to talk, and I wasn't a happy camper because my whole insides were just messed up as far as I was just feeling angry and agitated. So bless his heart. But so I happily do not eat any beef or pork, and I'm a much more happy person now. And Casey, you can't tempt her to. But something that people don't think about with this is beef and pork products are in vaccines. They're in a lot of vaccines. They're in a lot of your even like cosmetics, some lotions. They're in medications. So it's something you have to be pretty vigilant about. And in so many foods you've never guessed that they were in, they are. So we don't go out to eat a whole lot. And if we do, we try to find out what the menu is ahead of time so that we can make plans so we aren't sorry. For when I eat alpha-gal, it usually takes me about 1.5, 2 days to recover from it, sometimes 3. Casey, it's about the same, but it impacts her a lot more dramatically than it does me. She's just absolutely miserable, physically just miserable. I feel very agitated and ill and not good, but she just feels the pain in her body, so it's not good at all. And people don't think about this either. When we go out to eat, and people think we're just being goofy, but if they wipe off surfaces, it's so much better because that way we don't have cross contamination. Now, some people are so allergic to it that they cannot be around it being cooked. Like if they walk into your home when you were cooking beef, it could put them into anaphylactic shock, which is awful. And I didn't know this, but sometimes anaphylactic shock, it can, people think of the swelling of your throat, all your down your windpipe and all of that happening, the swelling. But it also can cause just like sudden drop of blood pressure, which that's what we've seen some with Casey is her blood pressure just going boom. So, and like with gluten, we found that too. If she has gluten, it can make her blood pressure go down. So that's that. What the main thing wanted to cover today was about ehrlichiosis, and other co-infections too, like Bartonella and Lyme disease. Then wanted to cover about alpha-gal. So I talked a little longer than I meant to. Sorry, had a few distractions here. Apologize for that. Life is happening. But I hope you're having a great day, and I will see you soon. Thanks. Probably next week sometime.